Next, we're going to talk about cardiac emergencies. This video is not a replacement for your CPR training. Instead, we're going to be talking about the AED, getting more familiar with it, its maintenance, thinking about when the application is for this to come into play in our emergency versus CPR. Okay, so to start, if you'll give me a little heartbeat with your hand here, like this, bump, 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 bump. Okay, so with a heart, we can have two different types of emergencies. We can have where the heart stops and stops pumping, stops beating. The AED is not going to help with this situation. And it's not going to magically start back a heart that's not pumping. What the AED does is for our heart, we got our heart going again, bump, 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 bump. Okay, and now just have it go crazy. All right, this has got an electrical issue where it's kind of like all over the place and the rhythm is off. That is where the AED comes into play and helps get the rhythm, shocks the rhythm back into that erratic heartbeat. So just making clear that we know if the heart has stopped, this is not going to shock it back into action. But when we see somebody who is unresponsive, which heart condition is going on? So what we can do is hook up the AED, and the AED is going to do the analysis and let us know if it can help out or not. But what we do have to do is hook it up properly. You'll see these not only in a lot of the dental practices, but you'll also see it at the gym, at grocery stores, at schools. So always kind of be aware and paying attention anytime you see one. Just make a mental note of where it is, just in case you ever are that first responder or come across an emergency and you have seen an AED at a location before. Feel very confident in grabbing this and running over to the victim and hooking it up and letting it guide you through what that person needs. When we open this, this has a protective outer shell, and then it has this one has a yellow button right here. We're gonna press, and when we open it, it's gonna start talking pretty loudly and giving us instructions. The first thing it's gonna do is tell us to make sure we've called 911.
Stay calm. Follow these voice instructions. Make sure 911 is called now. Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. When patient's chest and torso are exposed, remove square foil package from lid of AED. Tear open foil package across dotted line and remove pads. Next, separate one of the white pads completely from blue plastic liner. Begin peeling from the tabbed corner.
I took the battery out of this so I can show you a couple things without it talking to us the whole time that it's open. So just a reminder, we push the button to open it. First thing it's gonna tell you to do is to call 911. Then it's gonna ask you to expose the patient's bare chest. So we do keep a little kit on the side that has scissors to get through the clothing. And then we're gonna place the pads on the patient. Make sure you're using the adult pads or the pediatric pads according to the patient. If these are the wrong ones, you're simply going to detach the wires and insert the ones for the appropriate pads. Okay, same goes for changing them as they expire. I'm really into reducing risk of error, so I just wrote down here red, white. If you look at it from a vertical view, you could see those colors, but I just like very bold indicators that jump out at you. Sometimes that can feel a little awkward to do. Just make sure it snaps in all the way. And I have a set of pads here that are expired, so we can kind of see what it looks like once you open the pads. Imagine this is still sealed. We open the foil and out come the pads. Now you'll notice they're still connected with a wire. This is still connected into the device. And these pads have little pictures on them Pads are opposite of each other. There's two pads here, one on each side. You're gonna peel these apart and place them according to the picture. Now let's talk about that placement. Think about where the heart is in the body. Here, a lot of us will think of saying the pledge, singing the anthem, putting our hand on the heart. Or a little bit to our left side. We're not gonna put this pad on the heart. We're gonna put this pad on either side of the heart because we want that electrical shock to go through the heart. So the pads are gonna be placed on either side. One looks like it's down on the rib cage, the left ribs, and one kind of more up towards the right breast. And then that is gonna give a pathway for that electrical shock because it's going between the two pads. And it goes twice, it goes smack, smack. So if we have that heart that has stopped, that smack, smack, it's not gonna restart it. It's not gonna do anything. The only thing that's gonna restart where the heart has stopped beating, stop pumping, is CPR. That's our compressions on the heart, okay? This is going to smack the heart like pow, pow, okay? It's smacking that heart back into a rhythm, bum, 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 bum. If it was doing any kind of erratic heart rate, heartbeat. Okay, just like we looked at the adult pads, I do have an example of some expired pediatric pads. And you can see they look a good bit different. They have this little blue box here. Okay, and then when you peel these apart, you actually have some different options with pediatric patients on the placement. You can see there's the little picture to place them the same way we did with the adult pads on either side of the heart on the front torso of the patient. You'll also notice on the bag here, for a small patient, you could place them on the front and back side of the you could place them on the front and back side of the body. So that's really for a smaller child. Just an extra note about the placement of the pads in the case of a pacemaker. This is an external defibrillator. A pacemaker is an internal defibrillator that's been placed in the patient surgically. When you expose the patient's bare chest, you'll see what looks like a little box. If you see that raised box on the patient's chest, you do not want to put the pads directly on that box. You want to position them around it to where the shock is still going to go through the heart, but you don't want to place the pads on the box, on the pacemaker, on the patient. Okay, so let's talk about maintaining and checking your AED device. Now, like I said, this is the cardiac science. They're all a little bit different. So for the cardiac science one, the battery goes at the bottom, slides in, and drops into place. Now, it's probably gonna start talking to us the minute I put this in. There we go. Put that back in. You can see here it has an indicator that it's red. It's not ready for use. When this device is ready for use, this indicator will be green. What we're gonna do is we're gonna open it. You can see here.
Begin by exposing patient's bare chest and torso.
Level. This is what
Remove
we're
or
gonna
cut
check.
clothing.
You're gonna wanna check that spot that has the battery indicator, and also if either the little symbol for service or the symbol for the pads is lit up. That's gonna let you know that there's something that needs to be addressed. Now that we opened and closed it, you can see the indicator has turned green, so it's good to go. So when you check it, you're trying to make sure the battery is not expired, and that when you open it and close it, you don't see any kind of indicator lights that something's wrong. The battery lights are showing a good charge, and that we get this little green dot back on the outside. So we're gonna do that at least once a month to make sure that we're keeping track and making sure everything looks okay. Sometimes the batteries have a date on them for when they were manufactured, not when they expire. You're gonna have to look up that battery and find out how long the life is for the battery. You're gonna make an indication of that on the battery so people can check and know when they need to order a new one. Never be afraid to hook the AED up to a patient that's unconscious, that you're not sure what's going on. It's not gonna shock them if they don't need it. If the heartbeat has stopped, it's gonna tell you to do CPR. You don't have to make a decision as to whether or not this is the right thing to use. This device can tell you. All you need to do is hook it up to the patient correctly and follow the prompts.